Also, I brought forward a motion to have individuals who are visiting or working in grocery stores, pharmacies, riding on public transit or cars for hire, or anybody else that in the workplace wasn't able to stay 6 feet away from each other, to wear facial coverings. Very, very simple. There were a number of exceptions to that. If you have health issues that won't allow you to have a facial covering on, if you're exercising, if you're able to stay 6 feet away from others, that was the point of that. And some of the retail stores they're offering to provide facial coverings for their employees, and some aren't. But if they're mandated, then clearly they all would. And so 25% of our state right now is under a facial covering order. And it's just an excellent way to keep from transmitting or contracting this virus. Even a t-shirt mask is 60-some%, stops 60-some% of the particulates that cause the virus. So just looking for ways to keep our community safe, simple steps that can be taken to keep our community safe and healthy. And that's what I'm always looking for our community. So that unfortunately was voted down. It was myself and Commissioner Overman who voted for it, and the rest of the emergency policy group voted against it. Some of them wanted to wait to see if things got worse, which doesn't make any sense to me, but that's the way that the vote went. Let me give you updates before we get into our amazing guest. We have 873 positive cases here in Hillsborough County, including 18 deaths. As I always say, each of those numbers represents a human being, an individual that's leaving behind loved ones, family, friends. And so we are doing all we can to make sure that number stays as small as it possibly can and stop the spread of this virus. In Florida, we have 22,897 total positive cases, 633 deaths. It's estimated that we're testing in Hillsborough County about 1% of our population. And so we really don't know who has the virus and who doesn't. As I always say, one of the most dangerous elements of this virus is the ease with which it's transmitted, and then the fact that it's silent, that you can have it, no idea, you're asymptomatic, and you can be passing it on to others. So yet again, another reason for facial covering recommendations whenever people are in close proximity. So tomorrow is Friday. It starts the launch of our One Tampa at noon tomorrow. Please go to onetampa.org. We are providing rent, mortgage, and utility relief for citizens inside the city limits, and then also for small businesses that are inside of a low-income census tract or a community revitalization area, which covers a large swath of our city. The citizens, the relief for our citizens starts tomorrow, and then the small business starts on Tuesday. But please go to onetampa.org so you can see the information that you need. So when you either call on the phone 211 and press 7, you'll have the documentation you need, or when you go online as well, because we want to make it as easy as possible and get you some needed relief try to bridge that gap until the federal funds come in. So whatever we can do to help you out, we are certainly trying to do that right now in our community. So thank you again for everyone. I know it's dragging on here the weeks. I love seeing all the videos and the photos of the incredible things that people are doing while staying at home, but appreciate you staying at home whenever you can. Please do that. And when you go out, if you have to go to the grocery store, try to order your groceries online or have them delivered. If you have to go, please wear some kind of face covering. It can be as simple as your t-shirt up over your face. please do that to keep from transmitting this virus, or you know, getting it yourself. So being contaminated by it yourself. So not only are we flattening the curve by taking these simple steps, we're actually getting out in front of the curve, and we'll be able to save lives by taking those simple steps. We have ordered masks for all of our essential workers in the city of Tampa, and we'll be distributing those so that they'll be safe out there in the community when they're having to serve, because so many people don't have the choice to stay at home. You know, people working in grocery stores, in pharmacies, you know, our essential workers, our first responders, individuals that are providing your water, that are picking up the trash, people that have to go out there when a water main breaks. You know, those workers do not have a choice. So what we always say is, please stay home for us so we can be there for you. So very, very important. Now you cannot forget the dance party at 6 o'clock tonight. Kelly, I know you participate every night. I have no doubt about that. So our great partnership with iHeartRadio, 93.3 FLZ, Mix 100.7, 95 The Beat, Roomba 106.5, 98 Rock, and US 103.5. 6 o'clock, be there. Tune into one of those radio stations, come outside, say hey to your neighbors, get some exercise, and dance like nobody's watching. So very, very exciting. All right, now it is my pleasure to introduce my good friend, Kelly Paris, who I just love to hear talk because she has a beautiful Southern accent. As I said, she's the executive director of the Children's Board of Hillsborough County, and the Children's Board invests in partnerships and quality programs to support the success of all children and families in Hillsborough County. And Kelly has been there since 2013. Oh my goodness, that's incredible. You know, thank goodness neither one of us have aged.
Oh yeah, really. Do you remember you were one of the first people on my list to see when I got here?
Yeah, you wanted to make sure you didn't have any warrants. That's what it was.
That's right.
Yes, it was. And we've had a great partnership and a great friendship since then. So
yes, we have
done so many incredible things in our community, and the entire community owes you a debt of gratitude. So tell us how the Children's Board's been able to support families in our community during this time, during the COVID-19 crisis.
Well, we fund 69 partner agencies across Hillsborough County, and the vast majority of those agencies are still providing services in an alternative manner, of course, but they're still providing services. I think 2 are actually not providing services, and that's because they were school-based programs.
Okay.
So we've started off with all of those programs being at some level still providing services virtually and staying in contact with their population base virtually and by telephone. The Family Resource Centers, which we have 7 of across Hillsborough County, are open 3 days a week to provide services, and then that's Tuesday, Thursdays, and Saturdays till 6 p.m. And then they're working from home the other 3 days, but when they're working from home, they're calling their population base, their membership base, looking at what their basic needs are. We started this weeks ago. So we have been making sure that people have 2 weeks of food, making sure they have their medication. All of that stuff we started weeks ago. So we have been distributing to their membership prepaid cards to make sure that they limit their time out and that they have what they need to stay in and stay safe. So we tried after the Pulse nightclub massacre to get Hillsborough County to come together so we could all know which lane we could operate in and better serve the children and families of Hillsborough County. And for some reason, I think it was Irma that sort of fell by the wayside. But I want to encourage everybody to let's get that going again so we make sure that we can optimize what our nonprofits can provide for the citizens when we're in a time of crisis. We have relaxed the requirements from our ASO on telemental health, because we know that the more isolated the weeks go on, that it's going to become a greater problem. Next week, the resource centers are going to start surveying the population on a depression screen to make sure that we pick all of those people out and provide some services, either through the Crisis Center, Success for Kids and Families, the ASO, so that they come out on the back end of this as healthy as possible.
Good, good. Yes, that is such a concern. I mean, just kids that, that aren't having that social network of being in school and their teachers and all the way up to adults who've lost their jobs. And there really is such a need for mental health counseling in our community now. And I know that Clara Reynolds is a good friend of yours as well with the Crisis Center, and she was one of our guests here on our Facebook Live. And just the service provision and the way that all of our organizations come together for the betterment of our citizens is really, really wonderful. And I agree wholeheartedly that, and this is something that I've worked on in a number of different areas, is to ensure that we don't have that redundancy in service provision. I think the Children's Board does a very good job with that, ensuring everyone's covered and that we don't have a redundancy in service provision.
Yeah, I'm glad that you said that, because we had some money, some RFPs out for some services, some pretty large amount of money. We have since suspended that release because we don't know what the needs are going to be on the back end of this. So we have banked that money till we see what's going on the back end. And it just happens, and I know that you know this, but the general public probably doesn't. So in 2015, we started planning for releases in 2018. So we did town hall meetings in 15 to find out what the community and what the neighborhood on a micro and a macro level needed. And then we overlay all this data and everything on top of that, school, health, all of that. And then we develop the RFPs around what the community says it needs. So releasing that money right now, as a result of what that would not have been a wise thing. So we have a wonderful board, and they were very willing to suspend those releases and look on the back end.
Good, very good. So how has the early learning community been impacted by the pandemic?
Oh, I have been so worried about this, as many of you might know. The high of closures for early learning centers was about 489, which is getting huge. I mean, we have 1,100 and change registered, licensed early learning centers, and to have that loss in the capacity affects everyone. Today, there were 458, so there are a few reopening. We have been supporting strongly those centers because the ones that remained open were then they had all of these additional children to absorb. So we have been providing extra food, extra learning materials, all of that stuff for the ones that were open. And then we're supporting the ones that are coming out. There's a very, very, very small profit margin in that community.
Yes.
And so to be closed a month, you've got food startup costs, you've got all of the cleaning, all of these other costs on top of what your normal labor force would be. So we are supporting them and encouraging them to come out as soon as possible, as soon as it's safe, open their centers up so we can get people back to work when it's safe. And we have also been providing supports, early learning supports for the healthcare workers, and particularly targeting those that are CNAs, techs, janitorial staff, food staff, so that they can provide that absolutely necessary, vital service that they do to the other workers, so we can move people through the system. The early learning system is particularly worrisome to me because not only is it a loss for the time when children are developing at their greatest capacity to learn and learning at a rapid pace, but also for their safety at home if their parents lost their job. I mean, when we affect systems, it's a domino effect, and you know that. There's more abuse at home, there's less patience, there's all of that stuff. So we're doing everything we can do to support them and feel like we've been successful in that.
Good, good. Yeah, we're following the domestic violence calls, and I was on a conference call the other day with the chief from Seattle's a friend of mine, and she was on there, and she said that their incidence of domestic violence had risen 30%. Ours were down in the beginning, and now they've ticked up about 2%. But yeah, those are things that the kids, again, that they don't have that safety net of school. And they're, as you said too, now is the time that they are just learning, just soaking everything up like a sponge.
That's
So
right.
what's the Children's Board ASO, and how has it been beneficial for families at this time?
The ASO is one of the greatest things in Hillsborough County. It's really the biggest safety net I think that we have. It's called the Administrative Services Organization, and I think somebody was drunk when they named it that, but that's not what it does. So it's really a fund that provides all sorts of services to the case management community. So if you have case management services, it's a payer of last resort, but it can do a multitude of things. It can help out with your rent. It can help out with school supplies. It can do medical bills, on and on and on. If you are one paycheck away from homelessness and your car breaks down and you have case management services, that's what it does. And we are super busy right now, but that's what we've relaxed the really structure on to make sure that telemental health is available. So if you're in case management services and you have needs, that they need to be ASO providers, but ASO really meets so many needs in this community that it's unbelievable. And everything from kids needing braces on their legs to be able to walk. I mean, there are things that people don't think about that, the quality of life is just impacted greatly if you don't have the means to provide those.
Yeah, I heard tuned into a great program on NPR, and they talked about the psychological effect of some of those types of things, like economic hardships and those. And as I said, for us, a problem with your car is just a frustration. Others
Right.
can be a life-changing event. It means you don't get to work, you lose your job, and you're in that domino. Yeah.
Joe, you think about glasses.
Yeah.
I mean, I can't see anything without glasses.
Uh-huh.
I mean, you think about a child that's trying to learn that doesn't have glasses. You think about an essential worker that needs to go to work that has broken their glasses. Or, I mean, all of those things. I mean, we don't realize how crippling those small things are.
And now they're just they're magnified by the number of people that have been affected in our community, and it's so wonderful that we have so many different services that are available in our community. So what support is available for the parents that are first responders or healthcare professionals at this time?
Well, as I said, that telehealth support is going to be huge because we know that the constantly taking care of those emergencies and people in crisis is also a crisis for the person providing those services. So compassion fatigue is huge. And so I would encourage, any of them to take care of the telehealth services out there through Crisis Center, the ASO, Success for Kids and Family, wherever it may be, but also the child care issue also. If you don't have safe child care when you go to do your essential job during the day, that is a distracting issue. So we are providing supports for them in the form of a rolling 30-day taking care of the payments for that for them. So, they just need to let us know there's a process for that.
Yeah, and there's also, we've come together in the community on that issue too, and there are some of the hotels, they're empty, and so they're allowing healthcare workers or first responders, whoever doesn't want to go home because they're afraid they're going to take that virus home to their family, so they can stay at the hotels. And one of my fears for our first responders is now that the grandparents may be watching the little ones, and that's the last thing that we need older people around.
That's exactly right.
Yeah. So that's a great service. So how can families learn about all of the services that you provide?
Well, www.childrensboard.org is our website. There's a family resource guide in English and Spanish on that website. So they can go there, look at the services that best fit their needs, and contact those agencies. As I said, almost all of them are active.
Mhm.
It's just a very few. We handle some of the county's money through the ASO, their rent and utilities, and also domestic violence funds. I will tell you, we're working hard not to destabilize families. So we want them to stay stable during this crisis, because at the back end of this crisis, we know what this housing market's going to look like as far as access to affordable and attainable housing. So we're doing every single thing we can to make sure that families aren't destabilized, and that's really our goal through this. And I will tell you, I worked with a huge population from Katrina back in the day, and it's once the infrastructure is destabilized, it is hard to ever recover.
Yeah, without a doubt. And that's one of the reasons that, I worked with the sheriff did it, but I called the sheriff up and I said, listen, we've got to make sure that we aren't having evictions going on. He said, that's exactly what I'm thinking, and went to the chief judge, and they curtailed all of the evictions. And then we're trying with a number of other agencies to provide that rent, that can be that gap so that people can stay in their homes and not be evicted. And as you say, keep the family structure together.
It's interesting that, a moratorium on evictions is wonderful, but if you don't do anything to support those families, they're still going to be 3 months behind.
Right.
When it lifts. Yep. So we have all got to pull together, the Children's Board, the city, the county, and help support those families that have lost their jobs. And just think about the service sector. I mean, women and children in the service sector are going to be disproportionately affected by this, which I'm very worried about.
Yeah, yes, without a doubt. Now, how has COVID-19 affected the Children's Board and your employees and your family?
We've got a rolling, we consider ourselves an essential function of the county because we do fund so many services. So there are individuals that are able to work from home, the data people and IT people and all of that. But we have staff that are coming in on a split schedule so we can stay safe distanced and away from each other, doing a lot of meetings virtually. And I'm telling you, it's just not my cup of tea. It's a new normal, so we might as well get used to it. But we understand that our importance. There are only 9 children's service councils, children's boards across the state of Florida, and those 9 areas realize that we're one of the reasons why agencies work together so well, because they don't have to compete over funding. Yeah. They know the funding's going to be there. So we understand the responsibility that we have to the community and that we have to the taxpayers to make sure we're accountable for their dollars. So we're working very hard to make sure that those families that we reach stay stable during this time.
Good. Yeah, it is wonderful. I didn't know there were only 9. That's excellent. So what does the future look like for the Children's Board? Like what, we talked about our meetings, our virtual meetings being the new normal. Have you even had time to think about forecasting some of the changes?
Well, I will tell you, it's interesting that this came about at this point in time because we just contracted with the individual's company to do the town hall meetings where we divide the county up into 7 areas. We do listening stops, we do surveys, we do focus groups to determine what the releases would be in 2022. So we just signed that contract right before this hit. So the company is going to have to really look at how he's going to gather that data, how is he going to get input from those areas. So I think that's going to be very interesting, but it will certainly be a very different look as far as funding goes as compared to what it would have been had COVID-19 not hit.
Yeah, without a doubt. And that's the truth for so many different agencies. But it really is so wonderful the way that everyone works together, you know, with the Children's Board taking care of early education safety for our youth, just so many taking care of the parents, helping, you know, young parents as well, providing them with counseling and with educational services. And then with the spring, taking care of domestic violence and families with that.
Right.
Crisis Center of Tampa Bay, you know, they do so much, and they have basically the gatekeepers, the 211 number that you can call into that number regardless of your issue, and they can send individuals to the Children's Board or to
Right.
or to Feeding Tampa Bay, Metropolitan Ministries, whatever that need may be. So,
And I will tell you, with the early learning community, I can't tell you how important HCC has been in this process. They have 3 contracts with us. They've been doing virtual coaching in those classrooms where those teachers are so stressed. They have been, tonight, they have a big training from 6 to 8 on their COM program. And it's just been a wonderful partnership. When HCC closed, they literally moved their offices to a garage, and they've been working out a garage since HCC closed. So I'm so proud of that group.
Good. And yeah, HCC, what a diamond in our community, everything that they do. They actually gave their campus over on Del Mabry on Saturday to Feeding Tampa Bay. And I was out there helping with the food giveaways. And, you know, you see so many people that were in line for the food that would have been volunteers in the past. So this has really hit our entire community, but I have no doubt that we will come out of this stronger. We are a resilient group, and you can knock us down, but you can't knock us out. That's for sure.
We're tracking all of the basic needs to see if, you know, when they hit. When did the food shortage hit? When did the medication shortage hit? So the next crisis that we go through, whether it be a hurricane or whatever, that we know what to prepare for when we get to those points in time. So we're looking closely at that data.
Yeah, that's great. That's wonderful. Although I think we're at the point now, maybe we have another week or two before we cannot mention the H word. We cannot say hurricane.
Right. We don't need that.
That's all we need now. You get this. And then
I agree. This is enough.
I happened to be walking through the house the other day, and the TV was on, and I saw where a tornado had hit, and I was like, oh, those poor people after all of this. Yeah.
Right.
And it's such a unique situation. I've said so many times that we have something that hits our community, a hurricane or something along those lines. You know, the cavalry comes in from other areas to help us out, and now it's like you're on your own. Everybody's in the same position.
Right. And it is no, you know, it's not like you can have a hurricane shelter and escape this. Yeah. I mean, it is non-discriminatory, period.
Yep, without a doubt. It is. Do we have any questions?
Yeah, we have one from Charlie Frago. Are you disappointed that the curfew was overturned? Yesterday you said you would like to see 11 to 5 a.m. Will this action complicate efforts to slow the spread of coronavirus?
No, I discussed that in the beginning, Charlie. I'm sure you got your information, but that it's safer at home basically requires that everyone stay at home whenever possible. And so I'm not disappointed, and I don't know that I'm disappointed that the facial covering didn't pass. And I believe that I know that would have assisted us in stopping the spread of the virus. But, you know, you just got to keep fighting the good fight. All right. Well, thank you so much, Kelly. I really appreciate it.
Thank you, Mayor.
You do as well. Yep. And we will.
Anything we can do to help, we will.
All right. Same here. Okay, everybody, if you haven't signed up, text Tampa Ready or Tampa Lista to 888-777 for real-time information about the virus. Tampa Biz to 888-777 for small business information. And then you can always call our call center at 833-TPA-INFO. And if you want to get tested for the virus, call 813-272-5900, and they'll put you through a series of questions. Don't forget to get out there and dance and send your photos. I better see some photos, Kelly. Send your photos to @City of Tampa or #HappyAtHomeTPA. So remember, stay calm, stay safe, stay home, and stay kind. And let's make kindness more contagious than this virus in our city. All right. Thank you all, and God bless. Thanks, Kelly.
Thank you.
See you soon.
You too.